Meet Jacinta Wanjiru, alias Shiro, a resident of Ongata Rongai, Kajiado County, and a mother of 2 children. Shiro has been looking after a 2-year-old son who has suffered from pulmonary edema since birth.
Kumzaa na miezi 6 kwa wiki 2. Tukakaa Mbagathi. From Mbagathi tumekuwa hapo up and downs, wakasema kifua yake iko na maji. So tulibidi tukae hospitali for 3 months. No, tukatoka hosi.
Pulmonary edema is a type of edema disease that affects different parts of the body, as described by Dr. Mufadal Shokat.
Edema can occur anywhere in the body, as I discussed, because it is wherever in the body where there is space, there is a cavity where fluid can accumulate. So that's called edema. So the types of edema we get is when which part of the body the fluid is accumulating. So you can get it in your lower limbs, we call it lower limb edema. You can get it in your abdomen, where we call it ascites. But abnormal fluid accumulation in your lungs, that is now called pulmonary edema.
Being a single mom, the journey to find cure has not been easy, especially after being abandoned by the child's father.
After tuseme tu kama monthly lazima tu mtu ya kwetu mgonjwa. Monthly lazima nakaa tukirudi usi na kuniacha nikakuwa nikimtafuta kwa simu hapatikani. Na familia yao ilituachilia. Mamangu ndo tumekuwa kwa hiyo jani na ni hustler tu, so it has been difficult.
So what really causes pulmonary edema?
Common causes of pulmonary edema we see is cardiac related issues, cardiac pulmonary edema. So when there's a problem in your heart, the way it pumps blood, sometimes the flow, the pressure of blood flow going to your lungs increases, whereby the blood flow, the oncotic pressure, the lymphatic drainage all have to be in a system for no fluid to accumulate. But now due to a cardiac issue, because the blood flow is going to increase the pressure of the blood flow to the lungs, so that mechanism is disrupted and you start accumulating fluid in your lungs.
Dr. Shokat tells us that this condition is chronic and deadly, especially when the victim fails to receive treatment on time, and that it can affect anyone regardless of age or sex.
At first sikuwa na understand wanasema nini, but tukienda hospitali wanampea madawa, anarudi sawa, tena tunarudi tunanunua madawa.
Children, adults, but from my experience, I'll tell you that it is more common in the adult population than it is in the pediatric population.
Symptoms of pulmonary edema include difficulties in breathing or extreme shortness of breath, a feeling of suffocating or drowning that worsens when lying down, fatigue, cough with sputum and sometimes blood, anxiety and restlessness, wheezing and loss of memory.
Yani tu ana homa, alafu heartbeat inakuwa iko excess na kupumua tena inakuwa ni shida. Mimi nampeleka hospitali nikidhani ni homa.
Oxygenation is being impaired. You are not able to take the oxygen and not able to remove your carbon dioxide. You end up getting difficulty in breathing. So because of the lack of oxygen, then patients come fatigue, joint pains, malaise. So this is where it is, but mostly they are respiratory symptoms because your lung is being compromised.
About 1 million patients globally are admitted each year with a diagnosis of pulmonary edema, 75% due to cardiac-related issues, especially heart failure, 15% lung injuries and pneumonia, and 10% associated with other complications. Working as a bar attendant while earning a salary of only 7,000 shillings, Shiro has been struggling to meet her son's hospital expenses.
So hizi ni kopa hapa, kopa pale, saidia hapa, saidia pale. Nimekuwa tu peke yangu kwa life yangu. Sasa hiyo nina mtoto anafanya shule. Kazi ndio hiyo. hata sarali yenye unapata hata isaidi. Unaenda kukua tu madeni.
Sakina Rashid, K24